Hello and welcome to Pregnancy Info. Today we are discussing the best question you are asking about what is labor and what is the signs and symptoms of labor. So, labor is the process of your baby leaving the uterus. You are in labor when you have regular contractions that cause your cervix to change. Contractions are when the muscles of your uterus get tight and then relax. Contractions help push your baby out of your uterus. Your cervix is the opening to the uterus and sits at the top of the vagina. When labor starts, your cervix dilates. As you get closer to your due date, learning the signs of labor can help you feel ready for labor and birth. If you have any signs of labor, call your healthcare provider immediately. Now, we will discuss the signs and symptoms of labor in two parts. Number 1 is early signs and symptoms of labor. Number 1, the baby drops. Medically known as lightning, when is the baby drops? The baby's head descends deeper into the pelvis. For some women, this occurs up to 2 weeks prior to the beginning of labor. Other women may not notice this event at all. An increased urge to urinate. An increased urge to urinate can be a result of the baby's head dropping into the pelvis. The low position of the baby's head puts even more pressure on the urinary bladder, so many women approaching labor might feel a frequent need to urinate. As the baby drops, breathing can become easier since there is less pressure on the diaphragm from underneath. The mucus plug passage. Passage of the mucus plug is known sign that labor is near. Thick mucus plug produced by the cervical glands normally keep the cervical opening closed during pregnancy. These mucus plugs must be expelled before delivery. Pressure from the baby's head causes the mucus plug to be expressed from the vagina, sometimes as blood-tinged vaginal discharge. For some women, the mucus plug is not expelled until after labor begins. Others may notice the mucus discharge in the days prior to the onset of labor. Dilation of the cervix is a sign that labor is approaching. Although this is detected by the healthcare professional during a pelvic examination. This beginning in the days and even weeks prior to the onset of labor. Fully dilated means the cervix has dilated to a width of 10 cm. Thinning of the cervix. In addition to dilation, thinning of the cervix also occurs. This occurs in the weeks prior to labor. Since a thinned cervix dilates more easily, this sign is also detected by the healthcare professional during a pelvic exam. Back pain. Many women note that experience back pain, especially dull pain in the lower back that comes and goes as labor approaches. Back pain may accompany contractions felt in other locations or may occur on its own. Women also notice loosening of the joints, particularly in the pelvic area, as the third trimester progresses in preparation for delivery. Contractions. Contractions, which can vary among women and can be described as pounding, tightening, stabbing, or similar to menstrual cramps, increase in strength and frequency as labor approaches. Irregular contractions, known as Braxton Hicks contractions or false labor, occur towards the end of pregnancy during the third trimester. When contractions begin to occur less than 10 minutes apart, this frequently signals the onset of true labor, a burst of energy. In contrast to feeling extra tired as it is typical of pregnancy, many women describe feeling a sudden burst of energy and excitement in the weeks prior to labor, often referred to as nesting. This impulse often is accompanied by a sense of urgency to get things done or make plans for the baby. Feeling the urge to have a bowel movement or diarrhea. Women often describe pelvic pain and pressure as feeling the urge to have a bowel movement. Some women also report experiencing diarrhea or losing bowel movements in the days preceding labor. Your water bag breaks. Rupture of the amniotic membrane or once water breaking usually is a sign that labor has begun. Despite how it is often portrayed in movies, it is typically not a dramatic gush of fluid, but rather a slow dribble or trickle. Amniotic fluid should be colorless and odorless. It can sometimes be hard to distinguish from urine, but amniotic fluid does not have an odor. If you are leaking amniotic fluid, it is essential to contact your healthcare provider right away. You feel the urge to nest. In the days leading up to the birth, you might get a sudden burst of energy coupled with the desire to clean, organize, or prepare for your baby. This is called nesting, and it's thought that the urge to organize comes from an instinctive behavior of human being. You will stop gaining or losing weight. If you have been steady gaining weight during the third trimester as your body continues to nourish your baby, you may notice the number on the scale stops ticking upwards in the days leading up to your due date. And some parents to be actually lose between 1 and 3 pounds around this time, thanks to lower levels of amniotic fluid in more frequent bathroom visits. You will notice increased vaginal discharge. Watery, sticky, thick, maybe even pink, your vagina may release more secretions and mucus than you are used to as your body practices lubricating your birth canal, making it easier for your baby to slide out when the time comes. The discharge may also be pieces of your mucus plug breaking off. More on that in a second. Feeling a pressure. You may start to feel pressure in your vagina or pelvis. This may be due to lightening, which is when the baby drops down from the abdomen. Some women feel lightening as pelvic pressure or even low back pain. Now, the other phase of labor or type is advancing phase or active phase of labor. You will be able to you are entering active labor when your contractions are stronger, more regular, and happening closer together. It's a good idea to time them. If you will know you are in active labor if you have symptoms like painful contractions that about 3 to 4 minutes apart, each contractions lasting about 60 seconds, nausea, leg cramps. During active labor, your cervix or birth canal opens or dilates from 6 cm to 10 cm. Your contractions might happen even faster if your water breaks. So, this is all about signs and symptoms of labor. Hope you have understand all the signs and you will be able to know that you are in true labor or are in false labor. If you like the video, like it, share it, and also subscribe our channel, and you can give your precious comments in the comment section. Thank you.